of consciousness, moment of knowledge, moment of life, moment of the National Institute of Health. The National Institute of Health does research to provide solutions for diseases of public health. We investigate to make our lives healthier and fully. We diagnose the greatest health public issues of the country and those included in the international health regulations. We also coordinate and advise public health laboratories to ensure reliable and timely diagnosis, as well as we work with the local authorities so that their population is treated properly. We coordinate the blood banks and transfusion services of the country, knowing that blood is an irreplaceable and necessary property, essential to restore or improve health. It's time to donate blood. It's time to donate life. Because of the need of those who expect a new opportunity on life, we coordinate the donation network of organ and tissue transplants. It's time to donate. It's time to save lives. We contribute in the formation of human talents in public health. We strengthen knowledge, skills, and ability required for an optimum performance to face the challenges of the daily public health. We monitor the public health of the Colombian population, contributing with knowledge to take right decisions at the events under surveillance and the ones related to outbreaks or epidemics. We promote and divulge knowledge. It is time to understand that uncertainty is a space for science. Knowledge is the first step for change and innovation. We produce essential inputs for public health as polyvalent antivenom for the treatment of venomous snake bites. The cultivation media and animals contribute with the research, monitoring, and diagnosis in public health. We participate in programs of eradication, elimination, and control of diseases such as polio, measles, rubella, malaria, dengue, yellow fever, rabies, or gestational and congenital syphilis. Valuable result of this commitment is that after more than 14 years of work, we are the first country in the Americas to achieve the elimination of onchocerciasis. In the National Institute of Health, we generate knowledge for the treatment of venomous snake bites health, so that we all can live better. The National Institute of Health has been dedicated to science nearly a century ago. It was created because of the altruism and solidarity of Drs. Bernardo Samper Sordo and Jorge Martinez Santa Maria, who are the founders of Samper Martinez Lab. Nowadays, and after many transformations, it is an institute of science, technology, and innovation that looks to the future and is becoming a knowledge center. Hundreds of publications testify its scientific productivity, positioning it as the center of national and international reference for many diseases. It also publishes its biomedical magazine, which is recognized and indexed internationally, as well as ranked like one of the 3 most cited magazines in Latin American tropical diseases. It brings the public health knowledge through the fortnightly National Epidemiological Report IQEN and the weekly epidemiological newsletter BES. It is certified in different international quality standards like NTCGP standards in 1000, ISO 9001, IQNET, Risk Index Quality of Drinking Water, and Environmental Business Management Program. All of them provided because of our high standards. It has a workforce of women and men who are so well prepared and passionate about knowledge. Humans serve our society to our health service. Moment of new knowledge, of new technologies, new discoveries. The National Institute of Health is under the Ministry of Health and Social Protection. It's the health knowledge engine of our country, the leader in public health and one of the most important health institutions of Latin America. Moment of consciousness. Moment of knowledge. Health moment. It is the time of the National Institute of Health.